Bueno, continuamos. Nos toca felicitar a nuestros ponentes porque han respetado el tiempo perfectamente, lo han cumplido a rajatabla. Y continuamos con la conferencia Balmis. La conferencia se titula What did we learn from Covid-19 pandemic? Corre a cargo de doña María Van Kerkhove. Es la jefa de la Unidad de Enfermedades Emergentes y Zoonosis de la Organización Mundial de la Salud. María, al escenario. Un aplauso. Bienvenida.
Good morning. I'm very sorry for my lack of Spanish, but thank you very much for the opportunity to speak with you today, and a special hello to my family who are sitting just over there. So today I was asked to give a little bit of an overview of what have we learned from COVID, and I've changed the title to What Are We Learning from COVID because we're still not finished with this. Do you have... So I start where we are. So while on the 5th of May 2023, our Director General, Dr. Tedros, declared that the crisis of COVID is over, that the public health emergency of international concern is over. But while he said that the crisis was over, he said that the threat is not. So I know all of you in this room know where we are with the current pandemic, but I am here to tell you that the data that we have as the World Health Organization puts us in a very difficult position to actually say how much this virus is circulating. The virus is in every country. It is circulating, it is evolving, it is changing, and it is putting thousands of people in hospital. From the data that we have, we estimate that there are hundreds of thousands of people in hospital right now for COVID. And while the threat and the mortality is much different than it was 3 years ago, it's still causing a significant burden. What you see here on the slide are data coming from our global influenza program, which has been expanded to look at SARS-CoV-2 as well. And there's an increase in percent positivity from our sentinel sites. Right now, percent positivity is around 17%. If you look at the burden on the map there, this is a cumulative total. And we know that more than 6.9 million people have been reported to have died from COVID-19, but that number is likely at least 3 times higher. And the challenges that we face with this, where we can't put this behind us, is because the virus is evolving. And right now, we have thousands of subvariants of Omicron that are in circulation, and not one variant is dominant worldwide. So we need constant evaluation of the viruses that are in circulation so that we can assess their impact. The virus is highly transmissible, as you all know, but we don't know with the further viruses that emerge if these will be more severe or less. And luckily, I can say luckily, the severity of the Omicron sublineages are similar to what they were when they first emerged more than a year ago. And so I've given many talks in the last couple of years on lessons learned. And I'm not actually going to go through this here today. I'm going to take a little bit more of a personal view and cover a few lessons learned for me that I think all of you can relate to. The first is around trust and collaboration. From this scientific conference that you have here, you know that your relationships that you work on together, the research that you conduct, the collaborations that you have had for decades are what allow you to be able to act fast when something is different. So when SARS-CoV-2 emerged, we were calling it nCoV or a novel coronavirus. We didn't even have a name for it. We were able to act fast as an organization. And for me, what was so critical was that that was based on decades of trust. So our work at the World Health Organization relies on all of the work that you do. So I am often asked, how big is your team? And my team in headquarters is a few dozen people. For the COVID pandemic, we had hundreds of people who were working on this. We have people in our regional offices, we have people in our country offices, but my team is actually made up of tens of thousands of scientists. You are included in that. Because at the World Health Organization, we bring together collaborations, we bring together diverse expertise. And because we had to all go virtual, we were actually able to expand our reach in bringing more people to the table, more voices to the table, more disciplines to the table. And if an internet connection was available, we were able to bring you into that Zoom world and learn from you. And the collaborations that we had were faster than any tweet, any report, any peer-reviewed publication. And so when we knew so little in the beginning, we needed to grasp at all of the information that you were gathering from treating your patients to be able to put people in contact with one another. And so this was built over decades. It was expanded during COVID-19, and it will not contract. So our ability to be able to act fast in the beginning, my main role at WHO was actually not a spokesperson, was not to be a forward-facing person, but was actually to convene the world's expertise and to develop guidance and issue that for the world. And within the first 2 weeks of this notification of a cluster of pneumonia of unknown etiology, we issued guidance to all of our member states and contact points. We released it to the world in terms of who was a case, how did you treat those people who were infected, how do we prevent the onward spread, how do we keep our healthcare workers safe, what could healthcare workers do? And we issued the first PCR protocol. And this was done through a collaboration with Charity University, the University of Hong Kong, Erasmus, and Public Health England, as it was called at the time. And that publication of that PCR protocol set the world with the ability to actually test cases. With that PCR protocol and with that sequence made available, we as an organization were able to work with companies in Germany to produce test kits. And by the end of January, early February, we were shipping those test kits across Africa. And many countries in Africa had the ability to test faster than some high-income countries. So we were able to act fast. Next, leadership and empowerment. So everyone has a role to play. This is something I've said a lot during the pandemic. I don't know where it came from one day, but I was tired of hearing that it was only leaders, only political leaders that had a role. Every single one of us in the role that we have had, whether it's leading a lab, whether it's leading research collaborations, whether it's a doctor or a nurse, medical professionals, whether it was youth leaders or religious leaders, everyone had a role to play. And of course, when you have a situation like COVID-19, the emergencies are not led by the health sector. They're actually led by the prime ministers, the presidents, the kings and queens in some countries. And so the decisions are heavily influenced by many different factors. And some leaders are very good leaders, and some are not. And so you can have the best plans, and if you have poor leadership, the best plans will fail. And we saw that over and over again. So it was critical that leaders listened to public health professionals, they listened to medical professionals, they listened to academics, they listened to anyone they could to be able to have the right response going forward. And that was incredibly challenging as we were learning about this virus. We were learning about what this virus did in terms of its infection and disease, and the papers that were coming out. Not all science is good science. So what you see on the right-hand side are publications over the last 70 years. And I took this from Twitter, and I have not verified it. But this illustrates the amount of information that was being generated at the time. And you can see these are topics. And you'll see in 2020, COVID-19 coming onto the scene. So in the beginning of the pandemic, we had an agreement with all journals to submit papers or to provide papers to WHO. When I say provide papers to WHO, that was actually to me, in my inbox. And these were papers that were submitted. They were not peer-reviewed. They were not even judged whether or not they would go into peer review. And so in the beginning, we were grasping at any information that we can, generated by scientists like yourselves. But not all science was good science, and not all science is good science, even if they're published in the best journals. So, as I said, what we do is we translate evidence, translate data, know-how into how-to, and that how-to into coordinated action on the ground. And everyone that was involved in generating this research were leaders themselves. They convened the world's expertise on many different topics, whether it was the development of clinical guidance or therapeutics, whether it was the development of diagnostics, surveillance guidance. And so every one of the people that I had the privilege to work with were leaders in their own right. Communication with accountability. So, as you know, overnight, everyone became an expert in epidemiology, everyone became an expert in COVID, everyone became an expert on developing vaccines and what it meant to have a safe and effective vaccine. But not a lot of people who were speaking actually had accountability, not a lot of people had responsibility to actually implement what they were doing. And so a lot of people introduced me as the face of COVID, which I really hate. It's probably the worst way in which someone could introduce me to a crowd, because this is not a job I applied for. This is not part of my terms of reference. But over the course of 3.5 years, we have done hundreds of press conferences. We have done hundreds of live Q&As. We have done hundreds of interviews. We have done hundreds of member state information sessions, which are direct communication with our member states, the people that we serve, to be able to communicate what we know, what we don't know, and what we were doing to find out. Now, I can guarantee if you Googled me, you would find 2 mistakes that I've made online. It's not too bad. I mean, I am imperfect, but we came back every single day. And when we misspoke, or when I misspoke, we came back and we explained. But it's very difficult, and I had that responsibility and accountability. And I had the privilege to serve next to Dr. Tedros, Dr. Mike Ryan, and so many other incredible scientists. I know you all know Dr. Kate O'Brien. I work very closely with her as well. But we regularly come back to provide this information, and we get back up again. So we've had multiple ways in which we tried to make science accessible. And we tried to explain what was going on, because we were learning as you were. And we were out there every single day trying to explain what it meant, and really what it meant. Not just what was happening, but what it meant for you, what it meant for your families, what it meant for scientists to generate more information, to gather more knowledge, to turn that into guidance, and to do it all over again. Science and. So science has kept my feet rooted to the ground in the last couple of years. But never in my wildest dreams would I have expected the politicization, the polarization that we experienced during the last 3.5 years. And there's a lesson to be learned here, because it's going to happen again. So there's a big difference between evidence-based guidance and the policies that countries use. Policies take into consideration so many other factors that are there. But the challenge was when someone stood up and said, well, we are saying our policy is X because the data says Y. And then as the World Health Organization, we were saying, actually, we're looking at the same data, and it's not quite, we would be saying something different. And the reason for that, if we look at isolation period, for example, you know how long someone would need to isolate if we wanted to prevent onward transmission. But the policy set for isolation needed to be different because people had to get back to work. And the risk is different over time. So what we needed were governments and people to say, we're setting the isolation period to this because the risk is lower after this number of days and we need to get people back to work. But that wasn't happening. And so we were constantly questioned as like, why would you say something different than country A or country B? And that was quite challenging to be able to do that on a daily basis. And so science was an incredible triumph for me during this pandemic. Scientists came together. There didn't matter who was in office. It didn't matter the politics of individuals. Scientists came together, and I know that that will happen again. So the development of safe and effective vaccines did not begin on December 31st, 2019. It began with decades of work of mRNA platform work. It began with at least 10 years of work looking at MERS coronavirus vaccines and SARS coronavirus vaccines. But the scientific triumph of so many safe and effective vaccines is pretty incredible. And to date, we've had 13.5 billion doses administered. But in that incredible number, more than 30% of the world has not had a single dose of vaccine today. I'm not talking about a year ago. And so scientific collaboration is one thing, but access and equity is another. So while we could say that the development of safe and effective vaccines is a triumph, their distribution, arguably, was a failure. And this is something that we need to continue to work on. These data are as of September 23rd. This is not 1 year into the pandemic. This is now almost into year 4. And we're looking at the healthcare worker coverage of primary series and a booster, and the vaccination coverage of primary series and booster with older adults. These are the highest risk groups that we have in terms of trying to target vaccination. And if you look by region of healthcare workers, only 29% of the world has received a booster dose of healthcare workers. And that varies quite drastically by region. Among older adults, 55% of older adults have received a booster dose. Now, I didn't tell you when that booster dose was. That could be a year and a half ago, it could be even 2 years ago at this point. And so every single country right now really needs to target their highest risk groups, because these are the individuals who are ending up in hospital right now. So one of the things that we are also working on is strengthening the global health architecture. We are a learning organization as well. And one thing I'm very hopeful of is this pandemic accord, which is more than a handshake. It's more than a promise. It's actually a commitment, a binding agreement that member states are working on right now, looking at governance, systems, financing for pandemic preparedness as we go forward. Because we will have nationalization again. We will have shortages again. We may, if the next one comes, we may not have a vaccine that is so safe and effective and developed so quickly. So we need something that's stronger to make sure that we work much better together. I'm not going to talk much about this. I almost took this out. But one of the things I was not prepared for during this pandemic was the forward-facing work and the abuse. So as an organization, as I said, we bring together the world's expertise. We welcome debate. We welcome criticism. A lot of people have said to me, well, maybe you can't take criticism. We thrive on that because that actually makes us work harder. That makes us not sit back and say, well, we already know this, so don't worry about that. We don't need your input. We actually bring people into the tent. Some of the fiercest critics I've ever had, I've worked very closely with. Some of the most vocal critics we've had, they're actually sitting at the table. They don't often say that, but they're sitting at our table. I draw the line at abuse. Now, my family is sitting here in the audience, so I won't go too much into this, but I have never experienced anything like this, and I hope you in the audience have not experienced that. If you have, I'm sorry. But I also ask you to stand up for each other and to back each other up. And I can understand why you wouldn't want to put yourself out there, but for those of us who are actually in the arena with this accountability, we need your help. Because misinformation, disinformation, politicization will continue. And it's very well funded. So our work will become harder as we go forward. And I'm going to end with time. So I talked a little bit about acting fast, but time is something that we've all lost in the last 3.5 years. So we already know if you have experience with past outbreaks, past epidemics, you learn from that and you have a muscle memory to be able to act faster the next time. Now the entire world right now has a muscle memory for COVID-19. The question is, what do we do about this? I have a very difficult time talking about COVID to many people because no one wants to talk about it, which I completely understand. And that's the trauma that we've actually faced. So while individuals can move on, governments cannot. And that's the job that we have as the World Health Organization, is to support our member states to calibrate the response going forward. But the work for COVID is pandemic preparedness for the future. The work that you have all done, you know this, you build upon it. You don't go backwards. You build each time with each study that you do, each experiment that you do. And with the last 3.5 years, time has been lost on many of the other threats that we face. So there are many threats that we face right now with vector-borne diseases. Look at dengue and where dengue is circulating. We've had chikungunya outbreaks in countries out of season and at much higher levels. We have El Nino season. We have threats that we are facing right now. And with climate change, the vector can fly a little bit further north and a little bit further south, which are changing the dynamics of these pathogens. We've had a massive resurgence of vaccine-preventable diseases. Look at diphtheria around the world, because children didn't receive the vaccines that they needed in the last 3.5 years. So there's a lot of change that's going to be happening. So the threats that we face are constant. And so again, as individuals, we understand you don't want to live your life in fear, but as governments, we need the political will, we need the financing to be able to deal with this as we go forward, and we need the funding for research. It's a very hard sell right now. And I'll end with this. So this is an image I don't know if you've seen. It came from Brazil, and it's one that absolutely haunts me. This is a person who is in ICU dying. And the nurses and doctors there, they filled gloves with warm water, and they put the gloves around the individual to hold their hand, because so many people died alone. So that time, people will not get back. And I think we have not yet begun to grieve. I mention my family. So in the last 3.5 years, this is a picture of me in my little mural, who's sitting back there, very quietly. Hi, mural. And I isolated myself from them for a few months in the beginning of the pandemic because I was the one that was out there. The schools were closed. My husband and I made that decision because we don't have a back bench in Geneva. Our family is in the States, and everyone was scared, and we wanted to protect our family. And so for 2.5 months, I didn't touch my children. But even bigger than that, for 2.5 years, I was completely absent. So this is a personal statement, and I know many of you have dealt with this, but that's time I won't get back. And it's time that I have to make up with my family. And this is my older son, Cole, who's also in the back there. And they came to visit me at work in June of 2020. And there's a picture of a rainbow. And in the beginning of the pandemic, we were getting bashed. I mean, everything that we did. We were slow, we were stupid, sorry for the word. We were wrong, and there were a lot of it was just really bad. And Cole, my son, started drawing these rainbows for us, and he made a bunch of them. And I brought them to work, and I handed them out to people. And he wrote on the top, "Good job." And at least one person thought I was doing a good job. But on really, really dark days, really hard days that all of us have gone through, these acts of kindness that I'm sure each of you also have in your own life made such a difference. This hangs in my office, this hangs in Mike Ryan's office, and everyone that goes to visit him, he tells this story too. He's our executive director of the Health Emergencies Program. He comes in, my kids come in, they see Dr. Tedros, we're all a family. But time is something that we can't get back, and time and this loss of this is what actually propels me to stay at my job, to stay at WHO, to stay in an organization that I wholeheartedly believe in, to stay in science, and to keep fighting. And I thank all of you for every single thing that you're doing, because without your work, without your contribution, I can't do my job. The World Health Organization can't do its job. So with that, thank you very much.
Thank you, Maria. Oh, and just stay here if you want. We have 5 minutes for any question.
Sure.
Any question? One was really, really nice talk. Thank you very much. ¿Alguien tiene alguna pregunta? Es una buena oportunidad. No todos los días se tiene alguien como María aquí. Okay.
There's one here.
Here. Marieta Vázquez.
Thank you very much. Thank you for what you do. Muchas gracias por todo lo que hace, and for what you've already done. How can, now that people think that COVID is behind us, how can scientists, public health officials in all countries help the work that you do? What should our role be?
Oh, that's a wonderful question with probably quite a long-winded answer, but I think in each role that you have, depending on where you sit, if you are a researcher, we need the research to continue. If you are working in a healthcare facility, look at your staff. I mean, the health workforce right now has been absolutely decimated in the last couple of years. We've had people, not only have they died from COVID, but we have people who have left the workforce. We have people who are suffering from PTSD. There's some estimates that 1 in 4 health workers have diagnosable PTSD. We need you to continue the work that you are doing and making sure that the science is as robust and as sound as possible. In this noise that we are facing right now in terms of the information that is out there, we need really strong scientific voices, because the evidence base to set the standards, to set the strategies, to set the guidance comes directly from you. And I think if you could advocate that the work that you do is not peacetime, wartime, these analogies it's a terrible analogy to begin with, but the work that we do is a constant. And so you need that space, you need the financing that's beyond 1 year or 2 years, but have some sustainable financing to be able to keep up that work. So I need you to keep doing your jobs. You just stay in the arena and keep fighting in this space. If you're in politics, if you're in government, to make sure that the leaders that are in power now, they will not necessarily be the leaders who are in power when we face that next fight. Pandemics outlive any political cycle. And so what we need are systems that are in place. The capacities that you've built need to be sustained. So as demand for COVID goes down, you fill that demand with influenza or dengue or whatever threats that you face, because we don't want to lose that capacity. Research capacity around the world has expanded massively. We don't want to lose that capacity because it will be important for the next one. So keeping that momentum up, we've been trying to work with governments, with our academic institutions to keep up the momentum so that we don't lose time. And while the world is now facing and dealing with so many other challenges, with war, with floods, with droughts, with earthquakes, with other epidemics, this work, this base that we have in terms of capacities need to be utilized for whatever we face going forward.
¿Alguna pregunta más? Well, thank you, Maria. Thank you for this sectional talk, especially for your personal point of view that you gave us. Thank you very much for your hard work, that we really appreciate it. Thank you very much.
Thank you.
Bueno, vamos a empezar, vamos a dar 5 minutos, vamos a empezar el acto inaugural. Vamos a dar la entrega de distinciones también durante el acto inaugural, que una de ellas va a ser de María también. Y ahí tendremos la oportunidad de un poco también de seguir hablando con María y con el resto de homenajeados que vamos a tener. Tenemos 5 minutos y a las 1:30 estamos aquí listos.